I'm Dr. Jay Hitson with LT360 Health Center. We have a very different approach to healthcare. Now, even though we're different, it's actually nothing new. We actually based our entire program and how we're addressing primary care based on a research protocol that was done back in the late 1990s and actually early 2000. Back then, Blue Cross Blue Shield did a test pilot program with over 600,000 individuals around the Chicago area. And what they did is they actually took individuals who considered themselves to be more at health risk. They considered themselves to be less healthy than the average population, but they also considered themselves to be what they considered medical failures, people who were not necessarily okay with, or people who weren't necessarily happy with the standard medical model. So 600,000 people were part of this particular program, and what they did is they actually made natural health care the primary care. So before you could go to your oncologist or cardiologist or whoever else you need to see, first you needed to look at a natural approach, and then you could go see whoever you wanted. It was a very basic program, a very easy standard of entry. You just had to take a look at these approaches first. Well, they did this particular study for approximately 3 years. After the first 18 months, they had reduced hospital admissions by 62%. They had reduced hospital days in the hospital by 59%. Outpatient surgeries were down by 62%, and a remarkable 85% reduction in pharmaceutical costs. 85%. This program was absolutely outstanding, and the satisfaction rate, the people who were at the 600,000 people who were part of this program had a satisfaction rate of 99.9%. They loved it. Now, unfortunately, the program was discontinued. We believe that the reduction in pharmaceutical usage probably had a lot to do with it, but that's all up for speculation. So one of the things is we're using that model right here in LT360 Health Center because we're already seeing that reduction in need for a lot of other services, because once you're doing LT360, once you understand what this is about, we're already seeing the reduction in type 2 diabetes and heart disease. We're already seeing the hormone imbalances getting better. We have a 92% we get 92% results with anxiety and depression. We're already seeing this all happen. Now we're just combining it with primary care, with insurance coverage, and we're just really getting people the answer and the results that they are really looking for. Again, it's nothing new. This has been done before. It was done for quite a while, and it was extremely popular. We're just bringing it back, and we're bringing it here to the Middle Tennessee area. I'm Dr. Jay Hitson with LT360 Health Center.